Okay, let's go back here. Share. Now
There.
am I sharing?
Now it's coming.
Yay!
Yeah.
Right. I'll let you go
I'm
ahead and
trainable.
put the slideshow or the slideshow part on. There you go.
Hmm.
Yeah, just from the beginning should do it there. If you
Yeah, this recording thing um,
Oh, it's
wasn't.
in your way.
Yeah,
There we go. That should
there we go. Are we
There we
showing?
go. All right. Let me go ahead and introduce you. Okay, thank you everyone again for joining us today. I am Dr. Jeannie Hannon, Program Education Manager for Time to Heal Cancer Foundation. We're excited for today's session, Supplements, What's in It for Me? And so I am excited to introduce our speaker today. Terry Gable has her doctorate in pharmacy and is also has a diploma, a master herbalist diploma. Dr. Gable, now retired, was a clinical pharmacy specialist in psychiatry at the Veterans Affairs Nebraska Western Iowa Healthcare System, Omaha
Nebraska.
Division. That's a mouthful. And was a volunteer assistant
All
professor
right.
in the Department of Psychiatry in the College of Medicine at the University of Nebraska Medical Center. Dr. Gable provides private consultations and educational programming. She speaks throughout the region and nationally on herbal medications, psychiatric medications, and other topics. Dr. Gable is the author of several professional chapters and articles on substance abuse, psychiatric medications, herbal
Mhm.
medications, and nutraceuticals. Please join me in welcoming Dr. Terry Gable.
Glad to be here. All right, let's keep going.
Move on.
Disclosures. Christine, I think you need to mute your mic. There we go. Thank you. Well, just to know, I'm retired and I'm loving it. I am enjoying my time. I still do product consultations, as she mentioned. Um, and The information provided today is basically my opinion, reflecting the review of the literature and my experience with herbs and supplements and medications. None of the information is expected to treat or diagnose you. It's not the intention. So I'm hoping by the end of this, you'll understand a little bit of the risk-benefit ratio considering the use of natural products and be able to discuss the methods to determine the quality of available products. Whoops. I ask people all the time if they use natural medicines or natural products, and then they'll tell me that no, they don't. And they'll be drinking coffee or iced tea. They forget that that is a natural product. So primarily coffee is used as a stimulant, and how it works is by blocking the activity of adenosine in the brain, which slows the activity and calms us. As it slows adenosine, it activates the brain more. So it's kind of by blocking one thing, it increases the activity. Um, I think it says slows, but it should say activates. Dosing, normally people can tolerate up to about 400 milligrams a day of caffeine. That's generally 3 to 4 cups of coffee. Side effects, if you've ever overdosed on caffeine, which I have, upset stomach, jitteriness, your heart might race. You might have some diarrhea. It kind of depends on how it affects you. One of the interesting things I found is that they say that 1 to 3 cups of regular coffee a day might decrease the risk of dementia. That if you get over 6 cups a day, it might increase the risk of dementia. So we've got some dose-related potential benefit there as far as our memory goes. Calcium has a role in so many parts of our body. It calms the nerves, it calms us down overall, helps the muscles be calm. It can improve sleep, and of course, we think of strong bones and teeth with the use of calcium. In depression, we think it may improve the function of the neurotransmitters in our brain for mood and the hormones associated with feeling good. A neurotransmitter is a very small chemical in our body that regulates how we feel, and it's usually norepinephrine, serotonin, and dopamine. They think it may have some role in decreasing the metastatic actions of cancer, but that data is in its infancy as far as documentation. Our goal is to have 1,200 to 1,500 milligrams of calcium a day, and that's elemental calcium, but your body can only absorb about 500 milligrams at a time. And what they recommend is that you add up the dietary sources of calcium that you get every day, and then subtract that amount from the 1,200 to 1,500 milligrams, and only supplement what it takes to get to that full dose from your diet. So if you intake 1,000 milligrams of uh, calcium in your diet, then you only need to supplement 1,200 to 500 milligrams. So don't over supplement. Calcium citrate is currently thought to be best because it can be absorbed without food or with food. Calcium carbonate needs the stomach acid of a meal to be absorbed the best. Now, calcium can decrease the absorption of other nutrients, so it's important to watch for those interactions. It's also important that some medications can decrease calcium's absorption. So generally with medications, if you are going to supplement calcium, you want to take it an hour before or 2 hours after you take your other medications. And if you're on thyroid medication, you need to take it 4 hours after you take your thyroid medicine. And then there are some interactions between other over-the-counter medications and foods that can decrease calcium absorption, and those are on the slide for you. Foods that are high in calcium, dark leafy vegetables, fish, almonds, chickpeas, other seeds, prunes. And then, of course, your dairy sources are on the slide. Vitamin D, potential benefits are all over the board. The immune system, our bones, our teeth, and our energy levels are all part of having adequate levels of vitamin D. There's an inverse relationship with vitamin D levels in some malignancies, where if you don't have it, the cancer does more things. If you have, so it can be helpful in preventing the cell differentiation and it has an anti-proliferation activity. So the data is supporting the use of vitamin D to make sure you have normal levels of it. Having super high levels is not necessarily better. So interactions, again, there is some synergistic therapeutic activity reported with cisplatin, carboplatin, and doxorubicin, and potential additive therapeutic effects with the agents listed on the slide. Laxatives, steroid treatments, and anti-cholesterol medications can decrease vitamin D absorption. As recommended, on the average, 2,000 international units a day is the max recommended. That's, I think, 25 milligrams in your milligram doses. If your primary care provider, your healthcare provider prescribes a different dose, then follow their directions. Magnesium is another very important agent in our system. Again, it strengthens nerves and has a tranquilizing activity. It helps us relax, which is why sometimes it helps to take magnesium at night before you go to bed. A calcium and magnesium combination, it can be very helpful as well. regulation of calcium in bone and in the bloodstream are part of magnesium's effects. I've got some doses there. Basically, if you have more than, that's not more than 500 milligrams a day, and primarily because more than that is going to lead to a lovely laxative action. Magnesium citrate is part of our cleansing routine with the colonoscopy, so that's basically high dose magnesium. Magnesium citrate, magnesium chloride, and some of the other forms are on the slide are the most bioavailable, meaning that those are well absorbed by the body. We can also eat high fiber foods because they are high in magnesium, and some green leafy vegetables, nuts and seeds. So anything with fiber is good for you as far as your magnesium content. Vitamin K. There's two forms of vitamin K, K1 and K2. Vitamin K will help if you have low vitamin K levels. It can also improve calcium utilization in your bone and your vascular system because calcium in the bloodstream, vitamin K can move that from the bloodstream to the bones because if we don't have enough calcium in our system, then our body leaches it out of our bones. And then vitamin K can help balance that interaction so that we can keep our calcium in our bloodstream, which we need, but not overdo it and taking it from our bones. So utilization of vitamin K can decrease the risk of hip fracture, potentially improve bone density and decrease bone loss. But the ability to decrease bone loss on that data is mixed. Most of it's positive, but I don't think we know the full truth yet. And at nighttime, if you have muscle cramps, it could be an indication that your vitamin K is a little low. Overall, it's well tolerated in supplementation. Most of your products are derived from fermented soybeans. Do not take if you're taking warfarin as a blood thinner because vitamin K will decrease its effectiveness. And vitamin K is a fat-soluble vitamin, and so it may decrease the absorption of other fat-soluble vitamins, and DEA may also decrease the absorption of vitamin K. So with your fat-soluble vitamins, it's a balancing act to make sure you've got the right doses of each, blood levels of everything. As far as dosing, women, 90 micrograms of vitamin K. When you get down to vitamin K2, there are two subtypes that are most often used, and that's the MK7 and MK4. MK7 has a smaller dose of 100 micrograms and MK4 500 micrograms. Usually it's one dose a day with a meal. There's a slow onset of benefit. Again, with most supplements, you're not going to see improvement right out of the gate. Anyway, you'd have to test they have to do lab testing to demonstrate the benefit of supplementing vitamin K on your body. So you're not going to feel a difference, basically. Okay, just an interjection here before we go on to the supplements. We've talked about vitamins and minerals here. Sometimes it's a good idea to go ahead and meet with a dietitian or a nutritionist to talk about your diet, what you might be getting in your food. A nutritionist can recommend lab work to get your levels done. So just taking extra doses of some of these vitamins might not be necessary. A good all-around multiple vitamin that contains the full spectrum of vitamins and minerals may just be the best bet. And a specialist in that area can be helpful. So, and I think most grocery stores have a dietitian you can meet with for free. So free is good. All right. Ginsengs are adaptogens, meaning that they help our body deal with stress. It can be mental, physical stress, environmental stress. Panax and ginseng is probably the most common. When it comes to um, a ginseng, it's really important to pay attention to your medications because they do have a lot of potential drug interactions. The effect on the liver's metabolism of other medications can be a major confounding variable. The CYP3A information over in the drug interactions, that's a type of enzyme in your liver that regulates the metabolism of a lot of medications. And CYP3A can be increased in its activity or decreased in its activity by medications and supplements. So those potential interactions can be problematic. Again, we would not recommend the use of any of these in pregnancy. Basically, the maximum dose recommended for both of the Panax species is a max of 4 grams a day in divided doses and generally with food. At the bottom here is ashwagandha, and that's my favorite of the ginsengs if someone wants to take one. It's very well tolerated. It can have some drug interactions, so it's again important to check your medications against the listed and types of interactions for the ginsengs. Rhodiola is another favorite of mine. It has adaptogenic activities. It helps with stress. It can, in some folks, kind of be an antidepressant and anti-anxiety medication. And it has activating activity, so that increases energy. There's some indication that it can help prevent the proliferation of prostate and liver cancers, and decrease mutations and increase let me see if I can move this out of my way. There we go. And increases the repair activities of our body. We know it's a stimulant as far as the central nervous system goes, and we think it inhibits an enzyme that metabolizes medications called monoamine oxidase. That can be a significant drug interaction with some of our medications that are metabolized by that enzyme. For most meds, it's not a big part of the metabolism, but for some antidepressants, it's a big part of their metabolism. So the dose is standardized to 3% rosafen, which is the active ingredient in rhodiola. And you want to take it in the morning and noon before a meal. Start with the lower dose, see how it goes for a couple of months, and then increase to the maximum dose. If you have bipolar disorder, we recommend caution with rhodiola and maybe just don't go there at all because it does increase the stimulation and affect the neurotransmitters in the brain that could cause a manic episode. And again, 3A4 enzymes in the liver and P-glycoprotein in the intestinal system may have interactions with medications. P-glycoprotein is that product in the intestinal tract, which regulates how much drug is absorbed for medications. And if it's inhibited, then too much medication gets in your system. If it's activated, then you can decrease the amount of medication that gets into your system. The B vitamins have a host of things that they're involved in the blood system and in your body, your brain, your just about everything, your skin, your vision. As you can see here, there's just a lot of activity that's important with the B vitamins. As far as sources that you can eat to get your B vitamins, they're on the screen, but dark leafy vegetables, nuts, seeds, beans, grains, oats, fish, poultry. Um, so it's easy to get your B vitamins in your diet. Um, we don't recommend um, substituting one, like adding just one of these to your diet. A nice B complex is a good idea if you want to try increasing the B vitamins um, in your system. If you increase just one of the B vitamins, it can set off an imbalance with the rest of the B vitamins in your body. So, um, a nice just B complex, smallest one is about a 50 milligram B complex. Just one of those a day. You basically, if you start seeing super yellow urine, you're overdoing your B vitamins. So just a little bit of yellow, you're good. You don't want to signal the space station with your urine being so bright and shiny. One of my friends just started taking Siberian rhubarb for her menopausal symptoms, hot flashes, and mood issues, sleep, night sweats, etc. And it is effective for those things for some people, but not for everyone. It works on the beta receptor as far as the estrogen system goes, and it's part of the regulatory and protective effects in the brain, vessels, and bone. Um, there's a 4 milligram standardized extract of ER 731 from the root of the plant. Um, they recommend that your healthcare provider monitors your use, that if you don't see any activity or improvement after a month or two, then stop it. If you are seeing improvement, then they might recommend a medication holiday to assess if you really still need to be taking it. The N of 1 monitoring is measuring the intensity of your symptoms, how bad are your hot flashes and your night sweats, etc. And then in a month, re-rate those and see if there's an improvement in the numbers. Because it's hard for us to say, well, they were bad, but now they're not quite as bad, or I don't notice a change. So it's good to rate them. So if your hot flashes are an 8 before you start, and in a month they're a 6, that might tell you you're making progress in the right direction. If they're 8 at the start of a month and they're 8 at the end of a month, you can make the decision to whether you want to see if 2 months is better. But that concrete number helps us make a better decision. Interestingly, um, Siberian rhubarb is used as a prescription agent in Germany and European countries. It's not considered an herbal medication. Even though it's herbal, it's prescription version. And that's the 4 milligram standardized extract under the dosing. If you have an estrogen dependent cancer, then they would recommend you not use this. Oop, wrong way. Black cohosh is another opportunity for managing menopause and perimenopausal symptoms. And it may have potential to protect the bones, and it has positive benefit in the cardiac system. There's an indication that it affects the neurotransmitters in the brain instead of acting through the hormonal system. Again, it's a risk-benefit kind of ratio depending on your type of cancer and the medications you're on. It's standardized to an active ingredient in the blood system, and the product used is the dried rhizome or root 3 times a day. There is a standardized product called remifemin, and that might be the best thing to start with if you're going to trial the black cohosh. Sometimes the change in the dosage form may improve the response. People may or may not absorb the standardized product effectively, so the tincture or the extract might be a better form for a person to use. Flaxseed, it's anti-inflammatory. Um, they think it has benefit in cancer management, arthritis, and menopausal symptoms. Part of its effectiveness is its omega-3 fatty acids and its omega-6 fatty acid. It's high in lignans, which are phytoestrogens, but it's more likely that they are anti-estrogenic than estrogenic, meaning they work more like tamoxifen than actual estrogen. If you're going to use flaxseed, it's really important that you get ground flax or use a capsulized product because we cannot digest flax seed. So it's important to use a ground flax product. It's important to remember that it can decrease clotting. So if you're on another drug that thins your blood, you may have added a blood thinning activity. And a large amount of ground flax initially is not a good idea. So start low, titrate up, because it's a really good laxative. If you're looking at just taking the flax oil for its beneficial omega-3 fatty acids, the oil does not contain lignans, the phytoestrogens. So if you want to avoid the phytoestrogens but get the benefit out of the omega-3s, just use the oil.
Couple questions, Terry.
Uh-huh.
First, on flaxseed, it's okay for us to grind our own, right? Like I use a little coffee grinder to grind my whole flax seeds.
Yep,
That's
you can
good.
do that.
Okay, and then someone had a question on magnesium.
Okay.
Magnesium glycinate versus other magnesiums.
Magnesium glycinate is our new wonder version, so it's absorbed very well.
Yes. Okay, and then another question is for me. Yes, you will get copies of the slides, everyone. So you don't have to drive your hands crazy writing. So any other questions why we have the little break? Nope. Okay.
All righty. As far as soy, if you're a breast cancer survivor or a estrogen sensitive cancer survivor of any kind, avoid the isolated isoflavones. They recommend that we kind of, at this point in time, don't take those isolated products. Food use is fine. They recommend that you limit soy intake at this point in time to a third to half of your daily protein intake. So that can be a good way to get protein in your diet. But not the isolated isoflavones. There are also products that are isolated phytoestrogens from red clover and those things. They would recommend that you avoid that as well. My
And
miracle work. Pardon?
sorry, the isolated ones, Terry, those would all be like a supplement form. Is that correct?
Yes.
Yeah. Okay.
Yes. And then we'll on the label say isolated isoflavones.
Okay. Thank you.
Yep. Here's my miracle drug, my miracle herb supplement. What do you think? Garlic gets rid of just about anything. It's immune enhancing, it's an antioxidant, it's anti-cancer, antibiotic, antiviral, anti-inflammatory. It, it's even effective against vampires. So you just can't argue that it's not good for you. There are many studies looking at it in different cancers. Oh, there we go. And it seems to have the ability to be beneficial in several. So it might be something to consider. Daily dose, if you're going to use it in a therapeutic dose, is 1 to 4 cloves a day. Looking at the allicin content, about 4 to 12 milligrams daily. Again, 1 clove is about 4 milligrams of allicin, which is the active ingredient. If you're using an odorless dosage form, it needs to specify that it was non-heat processed because heat deactivates the allicin. And so we don't want that happening. So if you're going to use it in food, then crush it, dice it, let it sit for 15 minutes prior to use. The enzyme that converts the inactive ingredient to the active ingredient allicin is destroyed by that heat process. Even if you used one that says it's been deodorized, if you want to look at it that way, it only helps with the breath odor. And because garlic goes everywhere in your body, it will come out your pores if you're sweating. It will just, you'll smell like garlic no matter what. Drug interactions can be pretty specific. And I've listed here some of the anti-cancer medications that may be affected by therapeutic doses of garlic. It's not really an issue if you're cooking with garlic, but if you're supplementing with tablets or capsules, you may want to look at the interactions. And like I said, these enzymes here, the CYPs, are liver enzymes that can be increased or decreased in their activity by different medications. And so we've got some inhibition going on here with several of the listed anti-cancer medications. Again, it may affect the absorption of some medications, so we have to keep an eye out for that too. Oops, I got to keep going backwards. There we go. I do like some green tea. It has benefits in a lot of different areas. Its activity in cancer can be beneficial. It can be anti-angiogenic, meaning it stops the development of new blood vessels. It may decrease tumor growth and spread. It may protect against some of the cardiotoxicity we see with some of the meds. Again, this is something that needs to be discussed with your oncologist probably to see what kind of potential benefit it may have or problems with your medications. Some of the data indicates that it's 2 cups plus a day can decrease the risk of ovarian cancer or pancreatic cancer. Decreased oxidative damage to our DNA in smokers, so that could be an important variable. And again, it can affect the 3A4 enzyme in the liver and the absorption of medications through the intestinal tract, depending on how it affects. It decreases the activity of those two, so that can be a potential combination. Now, it may increase the bioavailability of tamoxifen and a blood pressure medication called verapamil. So we would want to watch for increased side effects showing up if you're on either of those meds. And basically, you're going to want to check interactions with a lot of medications. Oops. Omega-3 fatty acids, we like to think of them as being beneficial in cholesterol and triglycerides, and the increase in the good cholesterol, HDL, but unfortunately it also increases LDL depending on the individual. Mechanism of action, it may suppress the neoplastic transformation, it may increase the death of cancer cells and inhibit cancer cell growth, decrease the buildup of new blood vessels. Side effects, again, it may give you bad breath or GI upset. And again, it can come out of every pore as well. So just kind of have to balance that between intake and because too much, you might smell like a fish. usually a dead fish. Additive blood thinning in high doses can increase the risk of hemorrhagic stroke, meaning a bleeding in the brain. But generally, they're usually well tolerated if you keep in the normal supplemental range. And if you're like me and you don't like to eat fish, this might be a good supplement. Or you could take flaxseed. Problems with sleep. Sometimes we can get a benefit out of melatonin, which is a natural hormone in our body that helps regulate sleep. It helps regulate mood. It may be helpful to decrease toxic effects from chemotherapy or radiation, or increase the effectiveness of adriamycin and decrease adriamycin cardiotoxicity or heart effects. Seems to have an oncostatic role in breast cancer, decreasing aromatase activity and expression. It's an immune enhancer, and it can stimulate bone marrow cell production. So it's got some big potential benefits. We think it resets the circadian rhythm when it comes to stabilizing sleep patterns. And it's a naturally produced hormone in our bodies. And so it is secreted from our pineal gland in response to daylight. So if we suppress secretion of, get out of there, secretin, I think is the word I'm looking for. Daylight suppresses secretion, and dark increases the secretion of melatonin. It increases GABA in the brain, which is a neurotransmitter that calms us down. So we get decreased transmission of, I'll take that back. Okay, it's involved in growth hormone secretion, pain control, and sexual function. So it has a lot of different uses in the body.
Question, Terry.
Yeah.
When referring to tamoxifen, this includes other AIs like antrazol and letrozole, right?
Not necessarily. It's a metabolism thing, and they're not all metabolized the same way. Their mechanisms are similar. But so how they work are similar, but the actual chemical and how it's metabolized is different.
Okay.
That's a good question. I need to add that information. So thank you.
Stacy, for asking that.
Yeah. So side effects of melatonin, drowsiness is what we want. If you overdo it, you can get headaches and dizziness. If you're on something that already suppresses your central nervous system, you'll have an additive depressive effect. So long-term use of medications in the benzodiazepine family, such as diazepam, Valium, and Klonopin, those meds, Ativan, may decrease our endogenous melatonin levels. So long-term use of them may decrease our ability to use melatonin or have enough to have it function. On the other side, fluvoxamine, which is a older serotonin reuptake inhibitor antidepressant, it increases the production of melatonin, and by inhibiting its metabolism. Very commonly, melatonin is successful when we use it for jet lag. And basically, you take a small dose upon arrival at your new destination and for 3 days thereafter. And then you can stop it. Generally, it's recommended for insomnia at 0.3 to 5 milligrams an hour before sleep. There is some indication that maybe even smaller doses, like 0.1 milligram, would be more effective for some people. Another case with too much is not, more is not better necessarily. Whoa, come back. There's some indication that it can be helpful with the side effects of cancer treatment, and up to 20 milligrams a day. And that you should do that with your healthcare provider. Chamomile can be very helpful for insomnia. Um, it is an antispasmodic, meaning it can help with cramping. Again, it's sedative, it calms us down, can help with inflammation. Rarely it can cause allergic reactions. Basically, if you're allergic to chrysanthemums or in the other uh, plants in that family, you may have an allergic reaction. The spit and swish and spit test involves making a very strong cup of chamomile tea, swishing it around your mouth, and then spitting it out. If you have seasonal allergies, you know that itch in the back of your throat, the back of your mouth feeling, and that would indicate that you are probably cross-allergic to chamomile. Now, for sleep, you want to make a really strong cup of coffee, and that's basically using multiple tea bags in one cup of water, not steeping it longer, um, just making it really strong. And if you don't like the taste of really strong chamomile tea, there are other herbals that can help with sleep that taste better. So you can throw a couple of bags in the chamomile tea to kind of help it taste better. Or you can put honey in it. But if you want just a calming effect, you can just drink a regular cup of chamomile tea during the day to kind of take the edge off. And then again, it's balancing the effect you want with the strength of the tea. Valerian is another herbs that help with by causing sedation. It can just calm you down, so use a smaller dose during the day for anxiety and a bigger dose at bedtime for sleep. There's some indication that it might inhibit that 3A4 enzyme in our liver, so we'd have to watch for drug interactions. And one significant interaction was the use of valerian and the medication Xanax or alprazolam. We had one report of coma. One report out of the thousands of millions of people that have used this combination is probably not, one wouldn't think it's very significant, but coma is a pretty significant interaction. There's some potential hepatic toxicity, but that's under debate. We're not sure if it was actually the valerian or maybe it was a contaminant in the products used. So if you have problems with your liver, you might just want to bypass valerian just to be on the safe side. For neuropathy, alpha lipoic acid has been helpful in diabetic neuropathies, and there's indication that it might be helpful in other forms of neuropathy. So it may improve insulin resistance and glucose effectiveness. It has beneficial effects in chronic fatigue syndrome and liver diseases. So mechanism, we think it's acting as an antioxidant, but we're not quite sure that's the only thing going on. So in diabetes, they use 600 to 1200 milligrams a day, and that's probably going to be where the activity would be in chemotherapeutic neuropathy. Because it's an antioxidant, some anti-cancer medications work by causing oxidation. So it would not be a medication to use in those situations. Mushrooms. Medicinal mushrooms have been around for years, and there are multiple types of mushrooms that are available. Some are hepatoprotective, some improve the immune system, some help with blood pressure and cholesterol. And there is potential for them to interact with medications because they could inhibit the enzymes in the liver. And of course, if you're on medication to suppress your immune system, taking any of these supplements that will improve your immune system could be counteractive, could be bad. And then if you go to the literature and look at some of the data from the Asian areas of the world, they've been using mushrooms in treatment of chemotherapy and treatment of chemotherapeutic side effects. So there's some interesting data there. Here we have lion mane mushroom, and it's one of the new ones on the system for us here in the United States, and may be protective against dementia by stimulating the growth of brain cells and preventing neuronal damage as we age. It might help in depression and anxiety. It's anti-inflammatory, may help with the cardiovascular system and it has positive effects on cholesterol and triglycerides. It may thin the blood, so we have to watch if you're on a blood thinner. Dosing varies depending on what you read, but it's generally 3 to 5 grams in divided doses with meals. It's considered to be safe. It has very few documented side effects. Turkey tail mushroom is another new one on the horizon. Improved immune function, exercise benefits, healthier gut, reduced inflammation, stronger bones, lower blood sugar. Again, the interactions would basically be additive low blood sugar. It interacts with the 2C9, so cyclophosphamide and tamoxifen would be things to look at before adding turkey tail mushroom to your regimen. And if you're pregnant or breastfeeding, it's not recommended. Ginger, again, its claim to fame is improving nausea and vomiting with chemotherapy and with after surgery, motion sickness. I'll be taking ginger on my cruise to see if it helps if I need it. Side effects, it has pepper-like irritant effects in the mouth and throat, the gastrointestinal effect. It's considered spicy. So candied ginger is probably most well tolerated. It comes in a capsule. 1 gram for nausea and vomiting is the current recommendation. Cooking with it is also a beneficial activity. And we may have additive drug interactions. So again, in food, it's not going to be problematic. It's only if you're trying to supplement it in larger doses. Turmeric also has anti-cancer activity potentially. It's good for gastrointestinal disorders. There's interest looking at it in improving Alzheimer's disease. And the slide has some of its considered mechanism of action for why it's helpful in cancer. Cooking with turmeric is highly recommended. I put it in my tomato juice in the morning with some ginger and cayenne and black pepper, because you have to have black pepper to absorb turmeric. And where did it go? Again, gastrointestinal side effects are the most problematic. And I can't find any data on it being toxic, even if in high doses. Again, adding it to your food can be very tasty as well as beneficial. Dosing is 500 milligrams 3 to 4 times a day with food, especially black pepper. Drug interactions might be problematic. There are some chemotherapeutic agents that may find it beneficial to be combined with turmeric, but it may also decrease the effectiveness of some. So we need to really look at that carefully if we're going to use it in therapeutic doses. Milk thistle is my herb for the health of your liver. It does have some anti-inflammatory effects, anti-fibrotic, meaning it may decrease the likelihood that your liver becomes fibrotic. Milk thistle may interfere with cancer promotion and progression, may decrease chemotherapy-induced liver toxicity. We have some data that it helps prevent damage to your liver cells and promotes their regeneration. So that is also something to consider. Prevents glutathione depletion. Glutathione is another chemical in our liver and our body intestinal tract that is required to get rid of toxins. Side effects, gastrointestinal, and generally you're not going to see those unless you exceed the recommended doses. Standardization historically has always been to 70 to 80% of silymarin, which is the active component. Newer studies show that 58% might even be effective. I'd still go with a 70 to 80%. Dose is 200 to 240 milligrams 3 times a day. And that might be on the low side of the beneficial dose. So that data is still being discussed. It increases the clearance of estrogen. And again, it can affect the liver enzymes, specifically the 2C9 enzyme. It does affect glucuronidation, and then again, glucuronide is the one of the processes we need to clear toxins from our system. There's some anti-cancer meds that it does not interact with, and that may be dose related, so monitoring is recommended. Okay, guidelines for purchasing an herbal product. When you get your slides, you can read all of this, but it's basically buy stuff that's from a reputable company. Anything that says it cures everything, run away from. Watch out for conspiracy theories, because if we cured cancer tomorrow, nobody would cry. The drug companies would still make lots of money because there are other things they could earn money from. If something contains multiple herbs, proprietary blends, and it's like it gives you a paragraph of the things in their proprietary blend, that's probably not a good choice. We like to know what we're taking and why that stuff's in there. Double check products that are selling you something if they're providing you information. Get that information from another website. A company selling you an herbal product should have clinical data on their webpage. If they talk about clinical trials, but you can't get them, then that's bad. In the store, clerks are not health professionals. They are generally knowledgeable about the products that they carry, but they're not nurses and herbalists and doctors and pharmacists. So take their recommendations with a grain of salt. Use products from reputable and established companies, and we'll get to that more in a minute. And then this information should be on the label. So when you get a copy of the slides, check to make sure that it has a reputable label. When you get your slides, there will be companies that I've given the web page information on. Consumerlab.com, that's a subscription web page. But what it does is it gives you a comparison of select products that they have reviewed. And then they give you information on the product in general, how to buy it, what it is, what it does. So you can get information on good products there. The United States Pharmacopoeia is another place you can get free information on dietary supplements and herbal meds. And then they give you in products that they have, the company has specifically reviewed the products to make sure that they're not contaminated, they contain what they're supposed to. NSF kind of does the same thing. Again, this is a free reference. These are some of the companies that over the years I have known to be helpful and of good quality. James Duke, who is the godfather of herbal medicine here in the United States, and he's a botanist. These are companies that he swears by, or swore by, since he's since passed. Again, label doses are for the 70-kilogram male, so you might need to adjust it to your weight because we're not 70-kilogram males. If you're using drops, one normal pump of a dropper is about 30 to 40 drops, so you don't have to count it every time. And if you put 2 dropper full in a cup of water, you'll get a cup of tea made from that, dropping those drops of that herb. And again, try different formulations. You might absorb them differently. And we talked earlier about the N of 1 trial. Once you document your baseline, the baseline, don't look at that baseline number again until you're ready to redo your scale. All herbs and supplements should be stopped 14 days prior to surgery. And then we get into the references. So that's basically the talk.
Thank you, Terry. Great information. All right, questions. Let's see. Shelley asked if taking CDK4/6 inhibitors is turmeric and also green tea safe.
EDK2?
Pardon me?
What was say the question again?
If taking CDK4/6 inhibitors is turmeric and also green tea safe?
So taking something that inhibits that enzyme are turmeric and green tea safe.
Green tea, yeah. Yep, I believe. It's in the chat if you need to read it.
Well, I was thinking more than likely, yes.
Okay.
Just don't overdo it. Again, it's the N of 1 trial. If you start using therapeutic doses of either turmeric or green tea, what are you taking it for in therapeutic doses? And if you have a specific reason, document what that reason is. And then if you start seeing a change in that or side effects that weren't usually there before, then that would indicate you need to do something different.
Let's see. And then Tara asked, is CBD something you would recommend for sleep, joint pain, etc.?
Put it this way. I don't recommend it, but I don't hate the people want to try it.
All right. Thank you. And Terry, am I correct? Where most of the things, if you're using if you're doing it with food, like that it's usually not, you usually don't have those interactions and toxic, is that correct?
If you're like putting turmeric in your diet,
right.
and then drug interactions and side effects are generally not an issue.
Okay.
Is that the question?
Yes, that was the question, because it seemed like most of the things when, like garlic and the turmeric and the flax and the things where if you're adding it to your diet with real food or the real herb or whatever versus taking high doses in the supplements, that it's different. Is that correct?
That is correct.
Okay. Thank you.
If you're just using garlic in your tomato sauce for your spaghetti, not an issue. If you're
Okay.
taking supplements in high doses, then you might need to look at things.
Okay. And then let's see. Someone asked CDK4/6 is like Verzenio. It's a second line of treatment for breast cancer patients, right? I think. Sorry, I don't know
Say
if that
that.
was a question or you guys were just talking.
So say that question again.
Oh, I think, okay, yes, I think someone was asking the other person, CDK4/6 is like Verzenio. It's a second line of treatment for breast cancer patients. And then someone else says, yep, and Kisqali. Correct? I don't know. I don't know those drugs.
I don't know the answer to that question.
Okay.
It would be, something we'd have to look up.
Great.
But I wrote them down.
Okay.
so I can look them up. I'll know
Other
next time.
questions, and feel free to come off mute and ask if you'd like. I know you talked about fiber, so I always like this fun fact that not everyone realizes that fiber is only found in plants.
That is true. And not all plants,
Yeah, true.
but most plants.
Most plants, yep.
Yeah. If it tastes good, it's probably got fiber in it.
And then one of the other things I learned when I was studying for my lifestyle medicine certification was with like foods that are high in calcium, like some of the greens, like spinach, for example, is also high, spinach is high in nitrates, so we don't absorb it as well as like kale because it's low nitrates.
Nitrates can be a confounding variable.
Oh, thank you, Stacy. She was saying it wasn't a question, really, just a comment. Okay, thank you
Okay. Okay.
about the 4-6 meds.
Gotcha.
Other questions? We have a few more minutes if you have other questions. Terry's been doing this a long time and is very knowledgeable in herbs and supplements as well as medication. So as a doctor in pharmacy and her master diploma in herbs.
One of the things I got asked about at the conference was tart cherry juice,
Oh yes.
and the data really supports that it's helpful for sleep. And so it's recommended if you can't sleep to try some tart cherry juice.
Mm, awesome.
It's tasty too.
Yes. Here's another question. Do you recommend that we consider adding more supplements as we age? Great question.
Supplementation as we age is not necessarily necessary, but there might be some that could be beneficial if you have a specific concern going on while you're aging. I know as people get older, they worry about their bones. And so if you're worried about your bones or you've been told you have osteopenia, if not osteoporosis, then making sure you're getting enough calcium and magnesium in your diet, enough vitamin D, maybe in K2 would be things to look at. But you might have to specifically sub a supplement of K2, but get more calcium and magnesium in your diet. Be cheaper.
Yeah, thank you. Yeah, and that darn osteopenia and stuff we can get as a side effect from some of our breast cancer drugs.
Yep, that too. And as if we're treating cholesterol and other situations, some of those drugs can affect our bones too. So, and that's primarily by affecting our calcium and magnesium levels.
Yeah. Any other questions?
I've been asked in the past if I take too much calcium, what would be the symptoms?
Oh,
And some of the symptoms that you're taking too much calcium might be increased urination and thirst, decreased appetite, nausea, vomiting, and constipation. And then if it's significant, bone pain can be part of that, and fatigue.
wow. Thank you.
Mm-hmm.
Question about the mushrooms. Would
Okay.
would cordyceps be included in your list with reishi and the others? Would that also be a good be helpful?
Very probably. Was it on the slide?
No, it was not. I didn't see it. I saw reishi, I saw turkey tail, Oh gosh, I don't have all of them in it. I didn't see it on the slide,
Okay.
but my holistic guy had mentioned it. So,
Yeah, there are several products out there that contain a blend of the therapeutic mushrooms. So it might be interesting to explore some of those to see if their therapeutic blend covers some of the areas that you're considering or concerned about.
oh gosh, I didn't realize it was a blend. I'll check it out. Thank you.
It can be a blend. Not all of them are.
Okay.
So you can get cordyceps on its own, but if you're thinking of maybe several mushrooms, you might be able to find a product that's a blend of those. Because they
Mm,
use a lot of blends in the Asian countries.
okay. Thank you.
Another question. My parents swear by CoQ10, or what is that?
CoQ10, that's a naturally occurring product in our bodies. CoQ10, um, if you're taking a medication that um, to treat your, like say, high cholesterol, your statin medications, they automatically decrease um, CoQ10 levels, and that can lead to muscle cramping and damage to the liver. So supplementing CoQ10 can be very beneficial, specifically if you're taking a statin. But from anything I know about CoQ10, it's not going to cause you problems if you do take it.
Thank you.
And some people think it gives them energy, and good thing.
Okay, another question. With history of breast cancer, what would be the top supplements you suggest to reduce risk of recurrence? I know several are anti-cancer, etc., but I don't think I can take a bunch of them.
Um, there's no study out there that compares them. So it's kind of, well, garlic. It's my favorite for everything. Again, if you're not currently taking an anti-cancer medication, um, I think garlic's pretty good. It has not enough, it has enough data that I think just increasing your use of garlic in your dietary cooking um, might be one of the best ones to go to.
Great, thank you. Another question or comment regarding interactions, carboplatin. If you are done with chemo, do you still have to be concerned or only while on chemo? Oh, that's a question.
Only on chemo.
Okay.
If
So,
you're off of it, you don't have to worry about the drug interactions.
okay. Thank you.
Mm-hmm.
Anything else? We probably have time for one more question. All right. Well, if no other questions, oh wait. So there is. I'm seeing ads for high broccoli that prevents cancer.
High broccoli intake.
High broccoli. So are you just saying eating a lot of broccoli, Christine? You can come off mute if you'd like.
Oh, sorry.
That's okay.
Yes, it's called sulforaphane. It's
Uh-huh.
like very high broccoli. You can't eat enough. They said have to eat like 5 pounds of broccoli a day to get this effect. And they say it prevents cancer recurrence. Cancer. I don't know.
I have not seen that, but
Okay,
there are a lot of cruciferous vegetables that contain sulforaphane, and so eating more cruciferous vegetables would be my recommendation.
okay.
You can eat broccoli one day and Brussels sprouts the next day, and then cauliflower, and um, some of your leafy greens also have it. Um, but that is not something I have seen any data on.
Do you have any suggestions on like the microgreens, Terry? You know, like because you can, I mean, they're actual growing plants,
Mhm.
but
I don't see any problem with putting them in your diet.
yeah, like adding them to your salad or whatever.
Yeah.
Okay, well, thank you everyone for sharing your Saturday with us and for all of your great questions. And Terry, thank you again for sharing all of your years of knowledge and experience and wisdom with us. You know, you have such a great combination of knowledge and skills with your pharmacy background and your herbs and supplements. So you're priceless. You are priceless. So thank you so
Well, you
much.
are welcome. And
We
again, thank you all for attending today.
Yes. Everybody have a wonderful weekend. Oh, wait, I guess I got announcements. I'm sorry. For next time. So next month, August 15th, our Create Your Best Life is when someone you love has cancer. So we'll kind of focus on caregivers. Upcoming classes include Survivorship 101. We've got our next class is starting August 5th to September 30th. It'll be on Wednesdays at 6:30 p.m. Central Time. These are our virtual classes. We have a survivorship 101 under 45 for the young survivors out there, starting September 16th. And our next navigating brain fog class starts next week on July 21st. So if you have not taken our classes and are interested in those, please check out our website and I'll put some links here for you in the chat. Um, and we thank you all for coming and have a wonderful weekend.
All right. Take care.
Thank you. Thanks, everyone.